Hello, I'm back again, and in this episode, I want to talk all about heavy periods because my goodness, do so many people get affected by heavy periods, and it's one of the common reasons why somebody might come and see me or a gynecologist. So, if you don't know who I am, I'm Dr. Nikki. I am a GP working in Milton Keynes. I also run a private clinic called the Female Health Doctor Clinic. You can see me in person in Milton Keynes, or you can see me online or on the telephone if you prefer. And I can talk about all different things to do with women's health and hopefully help you to feel better. So basically, I want to talk about heavy periods and how we treat them and what possible causes there might be. How do you know if you've got heavy periods or not? Because it's, as I said, it's really common, right? So what is a heavy period? How do you know what a heavy period is? Well, if you want to get all scientific, 80 mils of blood loss or about 5 tablespoons is considered to be normal as part of our normal cycles. Anything more than that is usually just tissue and things like that from the endometrium, which is the lining of the womb that bleeds. Now, I don't know anybody that does that. Who measures their blood loss? I mean, maybe if you've got a menstrual cup, you could do that, but I don't think anyone is thinking about that when they're changing. So what I would say is if your bleeding is becoming excessive to the point where you can't do your daily activities, you can't go to work, you can't go to school, it's just interfering with everything that you're doing, that's too much. Yeah, it's just too much. Another way of knowing is if you become anemic, and I'm going to go over the symptoms of heavy periods in a little while, but being anemic, which means you've got low iron levels, is also another sign that your periods are just too much. So it's common. That's how you know if you've got heavy periods or not. If to you it's heavy, all right? So there's no need to be worried about how many tampons you use. I mean, obviously, if you're changing a tampon or a towel every half an hour and it's soaking through and you're flooding and you're passing clots, that's a really obvious sign that it's too much. But if it really is affecting you day to day, then that's when the line needs to be drawn. Okay, so the next thing is kind of what causes fibroids? What is it that leads to them? Not fibroids, sorry, that's one of the causes. What causes heavy periods? So fibroids is one of the things. So fibroids are basically non-cancerous growths that occur in the womb, and some people are more prone to them than others. Many people have them and they don't even realize that they've got them until maybe they've had a hysterectomy or someone's done a scan or something, and then they find them there. So I'm going to show you a little photo of what these are. Hang on, I'm just going to share my screen. Where are we? What are fibroids? So this is from the Oxford University. Let me just make sure that's in there. Yeah, that's it. That's cool. So on the Oxford University website, there we go. So you should hopefully be able to see that. There we go. So what you can see on the screen here is an image of a womb. And you've got the ovaries, you've got the fallopian tubes, so the tubes that carry the egg through to the womb itself. Now, this is a cut through, a frontways cut through of the womb. It's usually quite flat inside, so it's not like there's a big cavity or anything like that. It's flat, and then it opens out. So if you were going to have your have a baby in there or a coil or something, that would push apart the walls of that womb. Fibroids could also do that as well. So basically, you've got fibroids here in all different locations, and depending on where they are located will determine what type of fibroid you've got. So if you've got a fibroid that's within the cavity itself, you could have ones that are on little stalks. They're called pedunculated, and they're called submucosal. So it means they're within the womb cavity itself, and that's artificially pushing apart the walls of the womb, and that pushing apart of the walls of the womb increases its surface area, and leads to heavier bleeding because there's just more area to cause bleeding. Also, it interferes with things like contractions as well. So the contractions and the usual shutting off process of the blood vessels is reduced. Then you've got other submucosal fibroids are not on little stalks, but they're actually just within the lining of the womb itself. But they can also still be indenting in the womb space. Then you've got subserosal, which was within the muscle lining of the wombs itself, but towards the outside of it. So not on the inside, this one's towards the outside, and you can have pedunculated ones of those as well. So ones on little stalks that are on the outside. You can have quite large ones of those. And then you also have intramural fibroids. So these are within the muscle lining. So not on the outside, not on the inside, but somewhere in the middle. And that's essentially it. Now, the difficulty with this is ultrasounds and things can be tricky when you've got multiple fibroids, because the fibroids tend to scatter the image. So you might have a focus on one of them, but then you've missed several others because the focus, the ultrasound rays are kind of reflected back in a scattered pattern. So it's really difficult to tell. So that's why it sometimes can be quite confusing if you've had a scan and it says, oh, there's 1 or 2 fibroids, but then you have perhaps some surgery and you've got multiple fibroids there. So ultrasounds can only go so far at measuring them, and the person that's measuring them will try and do their best to measure them as best as they can, but sometimes it's hard to be able to do that just purely because of the way that fibroids cause the difficulties in the ultrasound. So that's one of the common causes of heavy bleeding. Then you've got other abnormalities of the womb itself. So polyps is another one. So polyps are kind of fleshy, squidgy kind of lesions, a bit like skin tags on the body, but they're found within the womb lining itself, or they can be in the cervix. And they can cause heavy bleeding because of that pushing apart of the walls that I spoke about with the fibroids. They can also cause irregular bleeding, spotting. You can get a bleed after you've finished your period. You can have a prolonged period with it. So fibroids and polyps are 2 of your kind of major causes of heavy bleeding. Then if you go further down in the womb, you've got the neck of the womb itself. So cancer, being an obvious one that can cause bleeding, is something that needs to be picked up rapidly. So going for your regular smear tests and things is really important. And anybody that has irregular bleeding ideally should have their cervix checked just to make sure that everything looks healthy there. So that's kind of like your mechanical causes of heavy bleeding. And then you've got other things like hormonal imbalances. So when you're starting to go through perimenopause, that can cause heavy bleeding. It can also be thyroid problems. So if your thyroid isn't working very well, so hypothyroidism, then that can cause heavy bleeding. That's kind of like your hormonal ways of looking at it. And also the more anemic you become, the worse it becomes as well. So actually keeping yourself topped up with plenty of iron if you are becoming anemic is really, really important. And then finally, you've got things like medication. So medication being blood thinners. So if you're on blood thinners for previous blood clot or something like that in the leg or the lungs, obviously you need to take it, but that can cause heavy bleeding. If somebody is on non-steroidal anti-inflammatory medication, so things like ibuprofen for a long time, sometimes that can also cause excessive bleeding, but it tends to be more the blood thinners that does it. So medications as well are also an important thing to think about. So if there is anything that you're taking that can lead to your blood becoming thinner, then that's a consideration. And it's often one of the ones that's actually weirdly overlooked. And then if you've got clotting disorders, so if you've got a disorder where your blood doesn't clot very well, so it's not medication that's doing it, it's your own body's clotting factors that don't work so well, that can also cause heavy bleeding. So things like von Willebrand's is a condition that can cause heavy periods. So while you've got these kind of mechanical things, these medical things, medications, you've also got causes of pain as well. So heavy bleeding can also be caused by things like adenomyosis. So adenomyosis is a condition where you've got abnormal cells of the lining of the womb. So they're not quite the same as the lining of the womb. They've got some differences, that find themselves into the muscle lining of the womb itself. They shouldn't be there. So if that happens, you can end up with heavy, painful periods, quite a bulky womb. It can make the womb bigger. So that can increase the surface area that causes more bleeding, and then the pain and contractions can make things worse as well. So that's one of the conditions. And the other one would be endometriosis. So endometriosis is kind of similar to adenomyosis. It's not the same, it's a different condition, but the abnormal endometrial type cells that should be in the lining are found elsewhere in the body. So it's found, anywhere within the pelvic cavity, within the abdominal cavity, within the brain, the lungs, anywhere else in the body. It's a different condition. So that's kind of the causes in a nutshell, really. And when you are looking to be investigated for this, then all of these things need to be considered. If you've had heavy periods right from when you first started having periods, then we also need to be thinking, is it a clotting disorder or maybe a thyroid problem? If it's something that's happened later, towards perimenopause, maybe you're in your late 30s, early 40s, and you're starting to get heavier and heavier periods, then that might be a cause as well. Now, one of the other things to think about in all of this is, could this be a sign of cancer? Now, unfortunately, yes, it could be a sign of cancer as well. So I've spoken about the cervix, but the other cancer that you need to be aware of is womb cancer. So lining of the endometrium can become cancerous. Now, there are certain people where this is more of a concern with. So if you've got a history of polycystic ovary syndrome, so where you're basically not ovulating regularly and your womb lining is becoming artificially thickened because of that, that can lead to endometrial cancer. Being really overweight can lead to endometrial cancer. If you've got genetic conditions like Lynch syndrome, for example, that can lead to endometrial cancer. So there are lots of possible things that might lead to it, especially if you're on things like HRT, for example, and you're not taking the progesterone properly, or you haven't been given enough progesterone for the estrogen that you're taking. That can also lead to endometrial cancer. And one of the things that people might go to their GP for on HRT is heavy bleeding, because that's suddenly started happening and it wasn't happening before. Now, estrogen HRT can make your bleeding worse anyway, because it kind of fuels the fire. It's the thing that thickens up the lining of the womb. So if we're giving you more estrogen, we're getting a thicker endometrial lining. But the progesterone hopefully will be able to keep that in check if you're on the right type. Everyone's different. Some people need different types to others. So we've got to think about cancer. We've got to think about benign conditions like fibroids. We've also got to think about blood disorders, hormonal imbalances, and medication that you're taking. So when you're seeing somebody about this, these are all the things that need to be taken into consideration. Now, obviously, if it's things like cancer, it's really important that this gets investigated very quickly. So one of the investigations is an ultrasound. Now, ultrasounds, I've already said, with fibroids can have limitations. They don't always pick up things like endometriosis. They don't always pick up things like adenomyosis, but they can be really useful in looking for things like polyps, although sometimes even that can be tricky, because you might see something that looks like a polyp and actually it's not. It's maybe some blood clots or something that are just stuck there. So ultrasounds are helpful. They're not the complete package, but they are certainly useful in investigations. The other thing that I would do as a matter, of course, of this as well is blood tests. Now, the NICE guidance doesn't recommend that we automatically assume it's something like a clotting disorder or a thyroid problem, and they actively discourage us from doing those blood tests. Now, thankfully for me, I work privately, so I can do the tests that I want to do. So I would always check someone's thyroid function. I think clotting disorders I would reserve for people that I feel actually genuinely do have a clotting disorder, because that's not always necessary, and that needs a special referral to hematologist or someone about that as well. I would also look at things like hormonal imbalances. So I'd look at your any signs of perimenopause. I'd look for any signs of thyroid problems. So all of these things together can build up a picture of what is causing this heavy bleeding. So you've had your ultrasound, you've had your blood tests. Maybe something's been found, maybe something hasn't been found. You may need to go for further tests after that. So if it was something like a suspicious cancer diagnosis, then I would want you to go and have an hysteroscopy as well. So this is a little camera that's put up inside the womb to have a look at it to see, what's causing this bleeding, maybe have some biopsies taken as well. Unfortunately, it's not a very nice procedure to have done when you're awake, and a lot of clinics are doing them with people awake. So always insist that you're having some kind of pain relief while you're having this done, because it's not pleasant at all. So these are the sorts of things that need to be done potentially if someone has a problem with heavy bleeding. Not always, but if it's a suspicion for things like cancer, then certainly that needs to be done. So once you've had your investigation sorted, you then think, well, what do I do to help treat this? Because I can't go on like this forever. And unfortunately, a lot of women are sent home basically saying it's normal, get on with it. And it's not normal. If it's really impacting you and affecting your life, this is not normal. So some things that your GP can do, or things that I can help you with as a GP in women's health. We can start with tranexamic acid and mefenamic acid, or ibuprofen is another way of providing an anti-inflammatory as well. So while I said that some anti-inflammatories can cause excessive bleeding, in short bursts, it can be really helpful for pain. So mefenamic acid is said to be more uterus specific. I don't think the research necessarily supports that. So simple ibuprofen for pain would be really useful, particularly in the 2 or 3 days before your period as well. That can help with reducing inflammation, basically, that's caused by the pain, that causes pain when you have your period. Tranexamic acid is a medication that helps to reduce the bleeding. So in some cases, it can reduce it right down to almost nothing. In other cases, it just kind of clots the blood together, and then you end up with maybe slightly bigger blood clots than what you're used to, but certainly not excessive amounts of bleeding. So everyone's different. I've had some people that have kind of on either end of those spectrums, but it should help with heavy bleeding. That's the point of it. We give it to people for all sorts of things, like nosebleeds and things, for example. So it's a useful medication to try, and you use that every single month with a period for the first 4 days of each period. And that's it. So yeah, they're your kind of sort of basic starter things that you can try. Now, beyond that, I might offer somebody a hormonal coil. So the Mirena, Benalexa, the Levocert, these are all high dose progesterone containing coils, and they can be inserted quite simply, usually by a GP, could be by a sexual health clinic, although a lot of sexual health clinics are now unfortunately not doing them for heavy menstrual bleeding. So you can come and see someone like me to have these fitted. Again, with pain relief, like with the hysteroscopy, you need to make sure you're having pain relief. And this little device keeps the lining of the womb thin. So for some people, it completely stops their periods, which is safe to do. For other people, it reduces their bleeding to the point where they can manage it so much easier. So that's my first port of call that I would go to. If you're not keen on having a coil fitted, you can always have something like the injection or the mini pill or the combined pill, if you're safe to do so. So all of these other medications, which are used primarily for contraception, can be used for heavy menstrual bleeding as well. And it's really helpful side effect of these medications that bleeding is improved with it. So while you might not need it for contraception, it's handy to use for this. So they're your kind of basic medications that you can try. And then beyond that, it very much depends on what the problem is and where you are in terms of having a family or not having a family. Because a lot of surgical interventions are not great if you want to preserve your womb so that you can have children. Now, one of the things that people can have done is what's called a uterine artery embolization. And what this does is it helps to cut off the blood supply going to the fibroids. So this is particularly useful for people that have got big fibroids, maybe 1 or 2 solitary ones. You go and see an interventional radiologist and they perform the procedure, and it helps to shrink the fibroid by cutting off the blood supply. It's a painful, potentially painful procedure, not the actual procedure itself, but the bit afterwards when the blood supply is taken away, the fibroid starts to collapsing on itself, and that's the bit that causes the pain. So anyone that's undergoing that needs to make sure that they are taking plenty of pain relief. Another medication that can be used as well by gynecologists, which is not, it can be womb sparing, is an injection like Zoladex or Prostap. Now, Prostap, these what these do is these help to shrink the fibroids by cutting off the hormone supply, which it needs in order to increase the size of the fibroids. So if you cut off the hormone supply, you also help to shrink the fibroids. Now, this is often used before things like uterine artery embolizations, before having myomectomies, which is where you actually physically open the tummy to cut the fibroids out surgically, individually. So this is a short-term solution to prep your body ready for these other interventions to be done. So if it's a fibroid issue, then something like Zoladex or Prostap can be really helpful. Adenomyosis can be helped with that. Endometriosis can be helped with that. So there's a lot of other conditions that can be helpful for. So these are kind of womb sparing, and then myomectomy is your surgical procedure where you have a tummy cut and the fibroids are removed surgically, and then the hole that's left behind is stitched together. Now, it's not a low-risk procedure. It's actually quite a high-risk procedure. It can cause a lot of bleeding. You have to be really monitored afterwards to make sure that you're not bleeding from wounds or anything like that. But if it's successful, then it can lead to successful pregnancies if that's something that you're intending to do. Now, unfortunately, sometimes myomectomies can distort the womb itself, so pregnancies aren't possible. So it is a risk. And also some people end up needing a hysterectomy anyway because there's complications of the surgery. But if it works really well. You just have to accept that there are higher risks associated with myomectomies. And if you are close to menopause, then you have to question, well, what's the point of just removing the fibroids? And actually maybe a womb removal itself might be better for you. So then after that, you've got things that are not, you wouldn't advise, obviously, if you wanted to have children. So one of them is what's called an ablation. This is where a device is passed up into the womb and it burns off the lining of the womb. That's the bit that regenerates every single month in order to give you a period. Now, if you burn that lining off, it can't regenerate. So in theory, it should stop the bleeding completely. It doesn't always work, particularly if you've got a bulky womb, a big womb, and the area isn't covered adequately by the thing that's used to treat the womb lining. But if it works, it can work really well, and it can be teamed up with a Mirena coil or a Benelexa or Levocert, one of those coils. It can be inserted as well at the same time to keep everything under control. And also, you still need contraception. In theory, you shouldn't, but because you can still ovulate, it's possible. In theory, you could still get pregnant. So the best thing to do is to think about your contraception choices around that time as well. If you don't like the idea of that, or you've tried it and it hasn't worked, then the next step is to have your womb removed completely. Now, obviously, if you're planning a family, this is not ideal, but having your womb removed is going to stop the bleeding problem. You can have your ovaries left in, you can have the cervix left behind. There's different ways of doing it. You can have it keyhole, robotic surgery, vaginal surgery, abdominal cut. It just depends on the size of the womb and what's going on with it. So essentially, that's it. That's kind of how we would treat heavy periods. It's how we would consider what we would do to help somebody, starting from very simple through to the surgical, and then the last resort, which is having the womb removed, which for many women is what they need. You can always do lifestyle things around all of this, and I advise you to always think about your lifestyle. So think about what you're eating, making sure that you're reducing your sugar and your processed foods, reducing anything that you feel causes the pain to get worse. So for some people it's gluten, some people it's dairy. I wouldn't advise you to start cutting everything out of your diet, but if you know there's a particular food you're eating that's making you feel more bloated and uncomfortable, then of course that's something to avoid. Making sure that you stay hydrated, getting regular exercise can be really good for your mental health, practicing mindfulness, meditation, having some talking therapy if necessary to reduce your stress can all help your resilience when dealing with pain. Of course, it's not going to treat the heavy periods, but it helps you to cope with things a bit better. And then if you're anemic, make sure that you're taking vitamin supplements as well to replace your iron. Many people are told their iron levels are normal, but the reference ranges have changed, and the NICE guidance has recommended that we supplement people with iron if it's below 30. So have a look at your reference ranges and see what it is. If it's lower than 30, then you need to be asking your doctor to relook at that again, because you might need some iron supplements. So there we go. That's it in a nutshell. So if it's something that you feel that you would need some help with, you want some advice for, you want investigations for, referrals, things like that, please book in and come and see me. You can also come and join me in my Facebook group as well, and I've put the links below this video for you so you can go and access both of those. But don't suffer. This is not one of those conditions where you should just grin and bear it. If it's really impacting on your life, then you need to do something about it, particularly if it's causing you to feel tired and weak and horrible because you're anemic. I've seen so many women being rushed into hospital because that's happened, and it's all completely unnecessary, because actually if she'd got the help sooner, she'd had her womb treated and removed, then she would have felt so much better quicker. So yeah, don't suffer is my bottom line on this. So take care, and I'll see you in another one of these coming soon. Bye.